Hello friends. In this video, I'll be discussing about very important question, how to study pharmacology. Now many students they come and ask what is the best way of studying pharmacology. Pharmacology is study of drugs. And there are so many drugs, different mechanisms of action, different adverse events, different routes of administration, and sometimes it becomes very difficult to remember all of this. So, what is the good way to study pharmacology? According to me, we should use an approach called as RA-RC approach. With this RA-RC approach, it becomes easy to study pharmacology. It becomes very easy to remember drugs. It becomes useful to understand the things. Now let's discuss what is the RA-RC approach. The first R among the RA-RC approach is read. So read. There is no alternative to reading. So the first R in the RA-RC approach is reading. How many times one has to read? It depends upon the person's capacity to grasp the concepts. Some students, they might understand and they will be very comfortable to remember the things after reading twice, thrice. However, some students, they might need readings multiple times. So depending upon your intellectual capacity, until and unless you understand the things, keep reading. So that is the first R of RA-RC approach. So read. Now the second aspect of RA-RC approach, there is A. Now A is basically assessment of what you have read. So after you read 3 times, 4 times, close the book, take a notebook or a diary and prepare your own notes. When you prepare your own notes, you can assess your understanding and you can also assess how much you can reproduce of what you have read. So that is the second aspect of RA-RC approach. So we have discussed RA. Now let's discuss what is RC of the RA-RC approach. And according to me, the third part, that is the R of RA-RC, is very important for studying pharmacology. And this R is relate. Now what is meaning of relate? Is because in pharmacology, there are so many drugs, and for us, it becomes very difficult to remember the things unless and until we relate that reading or the concept or the applications to something. Now obviously when I say relate, the question comes in the mind, how to relate? And for this how to relate, the answer is SAFE. So remember the acronym SAFE, SAFE. S stands for see the patients. Remember, when you want to study pharmacology, you have to see patients. Go to the wards, go to the hospital and see what we have read and what patient is receiving, how that can be related. That's one of the best approaches to study pharmacology. You have read drugs related to cardiovascular system, respiratory system, central nervous system related drugs, or maybe blood related drugs. Go in the wards, see which of these drug patient is receiving and try to relate what you have read in the textbook with the patients. So how to relate? The acronym is SAFE. So first is see patients. Now the second component of relating it is A. Ask questions. In order to understand pharmacology, we have to ask several questions to self as well as to our peers. Now, one of the second way is to form the groups of your friends, colleagues, and keep on discussing this by asking questions. You ask questions to yourself until and unless you get an answer to question why. So you have to ask yourself why this drug is prescribed to this patient, why this drug works in this patient, why other drug is not prescribed, what are the possible alternatives. So these questions you can ask yourself, and after you answer those questions, you also have the peer group discussion, and within the group of your peers you can discuss the questions. So how to relate? The answer is safe. S for see the patients. A is ask questions. F stands for feel. When you go to wards, you see a lot of medicines being prescribed to a patient, or when you go to pharmacy shop, or maybe you have some medications at your home which are used for your relatives, parents, or somebody. Take the strip, take that formulation in the hand so you can feel it, and also read what is been given on the strip, what is been given on the label, so that you can relate what has been given in the book and what is there on the label. So that is the SAF. S for see the patients, A for ask questions, F is feel the medications by touching the strips, taking the formulations with their packaging in the hand and reading them. And the last is E, safe. E stands for experience sharing. If at all you have an experience of using this drug, or you have seen somebody using this drug, share the experience. I think in the adult learning, we learn much better by sharing the experiences. So in the RARC approach, the first R was read. A was you assess your understanding by preparing notes. Then the next part of RARC was R, and that R is about relate, and the answer is safe. See the patients, ask questions, feel the formulation, read the strips or the packaging, and E is experience sharing. Now the last part of this RARC approach is the C, and that C is about checking your understanding, or now you have studied the subject, now check the different papers from different universities and see how much of those questions you can solve. So this gives you a better understanding about when you want to go for an examination, how many questions you will be able to answer from that question paper. So this is the overall approach that I recommend for studying pharmacology. So just to revise and just to summarize, when you want to study pharmacology effectively, use RARC approach. R means read. A means assess your understanding by preparing notes. R is relate. How to relate? See the patients, ask questions. F is feel the formulations. E is experience sharing, and C, last RARC, C is check your understanding or check the papers of different universities and see how much of them you can answer. If you can answer all of these questions, that is what you are preparing for the examination, and this approach RARC might be useful to help you study pharmacology in much better way. Thank you.